Hey y'all, so I'm Nakia. I need to come up with a name for these videos I'm gonna make. But I guess we could just start with like random tips from a geriatric NP. So I actually saw this post on Facebook where a nurse is in her NP program and she was asking for tips on finding a preceptor. And so I don't have all the answers. Um, and I see this like all the time, right? One of the things I think I would encourage people to do, especially when you know you're going to go to school, right? You know, the first thing people will tell you is don't wait till the last minute to find your preceptor, which your preceptors, which is super important, and I agree. One thing I would encourage people to do is if you're considering going back to school, start networking with providers around you. You know, those providers you're calling for orders, those, saying good morning and speaking to some people. And I know, and not it's not, everybody's not friendly, right, in every setting. And some people don't have the luxury of having, exposure to people who are willing to teach or different things like that. But I only say this because in my experience, I started connecting with people around me when I was thinking about going to school, just making small talk with some of the providers that I worked with. You know what I mean? Getting to know them a little bit. Obviously, I didn't have that opportunity with everybody. But again, just starting a small conversation because honestly, good things can come from really letting our walls down and starting to talk to people, um because you'll find out maybe they themselves are not going to be an option for a preceptor, but they may know someone, you know what I mean? And if you have a good work ethic, um you're personable, if you're just you, and you work really hard, some people will be willing to recommend you to a friend, to a colleague, for clinical hours. This is, I'll give you an example of the networking piece. So as a RN, you'll get to know that I primarily worked in long-term care. And so, there in those facilities, you're heavy on trying to establish a rapport or relationship with these providers because the more you tend to interact or try to get them to warm up to you and show your work and that your follow through, all that, you're just hardworking, you're able to get a lot more for your patients, and things like that. You develop a really good working relationship with these people. And so I actually got one of my preceptors really legit from just starting a conversation. So one of my mentors, preceptors, I just saw her in one of the buildings and I was talking to her, just good morning. I was working for a totally different group than her. And we were making small talk, and I honestly don't even remember how it came up that I was in school. But she actually told me like, hey, just so you know, I precept. Just a complete, was not even going that direction in the conversation. And later on, she ended up being one of my preceptors and a mentor, to this day. And another way, again, is connecting with people that I worked with. So I had a boss, a manager who, again, saw my work ethic, all of that. A doc that I work with saw my work ethic. So I was lucky enough, right? When I left one of my previous jobs, when it was time for clinicals, I reached out to my former manager and said, hey, I'm looking for sites and hours. And she passed along my email that I sent to her and the information and what I needed. And one of the docs in the clinic picked me up, and then again, I was blessed enough that when it was time for my women's health, which was a hard area for me because honestly, I've never worked women's health. I worked as an RN, I worked in long-term care, I worked hospice, I did primary care clinic for a while. And so I didn't have access to a women's health provider. And she was actually nice. My manager, my previous manager, made sure to, like, when I'm like, hey, I'm not hearing anything, to again, hey, can someone help? It is super hard, right? And I know everybody is not, lucky enough to have these connections and relationships, but I would strongly encourage you, if you're thinking about going back to school, having conversations with people, maybe even people you've never thought about, or again, that provider that you look to for a lot of orders, for a lot of assistance. They may not be able to help you, but they may be able to direct you to someone who can. So that's just my random tip of the day. If you have any questions, anything to offer, right? If you're an NP currently or in school, what are tips that you would give to an NP student on how to find preceptors?